Welcome to a new episode of Science in Context. I'm Sabine, and this week Dariya Nikitin joins me to speak about meningococcal vaccination against gonorrhea. Dariya, can you explain how this works?
So we don't have a gonorrhea-specific vaccine. However, in recent years, studies have shown that following some vaccination programs for adolescents and young adults against meningitis B, there have been lower than expected numbers of gonorrhea cases in the vaccinees than in the wider unvaccinated population. And this cross-protection from some Men-B vaccines comes about due to similarities in proteins found in the membrane of the bacteria that cause gonorrhea and meningitis B that are also in that vaccine. So currently the only Men-B vaccine that protects against gonorrhea is 14-Men-B. And of course, this led researchers to ask the question, can we repurpose 14-Men-B in the fight against the worsening gonorrhea epidemic in England?
Your study looked at cost effectiveness especially. What were your key findings?
So firstly, we found that targeted vaccination of at-risk MSM was cost-effective and even cost-saving for the health system, regardless of the level of uptake that could be achieved. And one thing that sets this work apart from previous studies is that we compared using 1 or 2 doses and found even with a single dose, vaccination was cost-effective, although using 2 doses was more cost-effective due to greater protection. That's despite the vaccine only being partially effective against gonorrhea. Now, of course, it's not enough to have an effective vaccine, people also need to want to get it. So another feature of this work was to investigate how variation in vaccine attitudes could affect the impact of a potential program. And the value of this information hadn't been quantified before. We've shown that the vaccine sentiment could be affecting the impact of a program up to 60%.
What does this mean going forward?
So firstly, this adds to this growing body of evidence that implementing a targeted 14-Men-B programme is beneficial. The Joint Committee on Vaccination and Immunisation has already advised on this, and the government is considering that advice. But in the meantime, our findings point to a need to further explore vaccine sentiment in MSM so that vaccination can be implemented as effectively as possible when that time comes. And behavioural science will play an important role in this, and MSM community engagement studies will be crucial in collecting a range of views across MSM.
Thank you so much for your time today.